Welcome back to SIROWORLD 2016. I'm David Temple here, joined by Dr. Reznick and a gentleman we've all become familiar with. We call him T-Bone. That's all we need to say, right?
That is all we need to say, yes. And thank you for having me back.
Man,
I don't know how you've gone a whole day without me.
It's not normal.
It isn't. I'm disappointed.
I've asked, where's T-Bone? They're like, no, he's busy. He's out there teaching.
They've been working me.
I'm like, what's up with that?
They work us here.
Okay.
Yeah.
Well, how about we talk about a little SICAT Guided Surgery?
Let's do it.
Because I know both of you. I've been with Dr.
I've done a few.
Yeah, and he knows his stuff, and I know you know your stuff.
Well, that's questionable. I at least can make it up.
Why don't we just jump in there and talk about, I've got some really good questions, like what are the indications to use an OptiGuide?
All right, so, honestly, we've got multiple guided solutions today, and for me, we're using the OptiGuide mainly when I want the most accurate solution. Okay, so when the benefit of the OptiGuide is that we have a surgical guide now that they will be double-checked. Okay, so the OptiGuide, unlike traditional guides that are just guides that are made, the OptiGuide is then double-checked afterwards to make sure that the ring is placed correctly, that the guide is fabricated properly, and that they meet a certain tolerance and the trajectory is matching within their tolerance spec, so that you can know that you have a guide that's going to be created to meet the exact specifications that you're looking for. So when I'm looking for that specific case, that anterior case, that immediate case where I need absolute precision, that's when, without question, I go for the OptiGuide.
How about yourself, Dr. Reznick?
The OptiGuide is, as T-Bone said, gives you accuracy that is beyond belief. I mean, within microns. And the beauty of the OptiGuide is that it's a completely digital workflow. So, unlike the classic guide, which is the mainstay of SICAT Guided Surgery and the original product that we had, we're able to do everything digitally, which means we don't have to take physical impressions. We don't have to burn a CD. We don't have to ship anything to Germany to have the surgical guide made. All we do is upload it, upload the data directly to SICAT in Germany, and within 24 hours, they're processing the surgical guide and sending it back to you. So your turnaround time, rather than being 2 weeks, like it was for Classic Guide, is down to a week, which is really a great benefit when you want to bring the patients back. Patients don't want to wait necessarily 2 weeks after the consultation. They want to come in, they want to get it done. And so not only can you get it done more efficiently, more quickly, but it's more accurately placed also.
Everything is about digital, isn't it?
Yeah, it is. Yeah. But on that note, if you don't mind, David,
yeah, sure.
I think one of the misconceptions that we have with OptiGuide for our non-CEREC users, I mean, I know unfortunately there's a few out there, okay, is that many believe that the OptiGuide is only available to CEREC users. But you can take a traditional impression and send it to SICAT, and they will convert it into digital data for you. So you can have the benefits of the accuracy of the OptiGuide and the efficiency and speed of the OptiGuide in a traditional workflow. So you don't have to take a second scan with the radiographic template. So there are some benefits there as well.
Yeah.
I got a question, because we've been talking about the merger of Dentsply and Sirona. Have you seen any shift or change or improvement since the merger as it applies to this operation?
I mean, I think it's a little early. I mean, this is fairly new for everybody. But, what's exciting is the potential for these two companies coming together from different, the companies' philosophies are aligned, but they're different. Sure. And bringing them together and sharing ideas and bringing together all the clinicians we have, all the people in research and development and on the technical side, are working towards making implant dentistry and dentistry much improved. The concepts, the things that we're thinking of as far as improving workflow, improving the capabilities and technologies are mind-boggling, and things that we wouldn't even thought of years ago, and now bringing both sides, bringing Dentsply and Sirona together, and the expertise on both sides. We've got a lot of really exciting things coming.
That's one thing I keep hearing a lot about is the spectrum of workflow.
Yeah.
You know, what I would say is anytime two big companies come together, we always have this fear of change. And the good news is we haven't seen any negative change at all. I would say that what I've seen is synergy.
Yeah.
and I've seen integration, and that's really what makes our workflow so good and unique to begin with, has been the integration, and now we're seeing the synergy of how products can work together, and we will see a rapid advance in the future, and ultimately our patients will benefit, and when our patients benefit, our practices benefit, when our practices benefit, our families benefit.
Yeah.
So we will see movement in the future.
Yeah, I mean, a lot of mergers, you have companies that do the same thing or similar things coming together, so they have economy of scale. What we've got here is two companies that are both aiming for the same goal, but do different things that complement each other. And when you bring them together and they work together, you can do some amazing, amazing things.
And back to the SICAT before we wrap things up. Anything that I've missed so far that we haven't covered on the benefits to the guides and the support?
Well, I think the nice thing about SICAT is that it's an integrated workflow. You know, at the end of the day, what you're getting with SICAT is an integrated workflow. One company provides the software for planning. They provide the integration tools. The company provides the hardware. They provide the actual fabrication of the surgical guide. They will actually double check your plan to make sure there's no artifacts, to make sure that the guide will actually fit in the mouth the way you expect it to fit. They'll confirm that the accuracy is there. They'll give you, it's peace of mind at the end of the day, right? Sure. And at the end of the day, when you're doing a procedure that most dentists are afraid to do, a procedure that patients are perceive as a fearful procedure, you want peace of mind.
Sure.
Okay, and that's what they provide. It's peace of mind. Yeah. It's peace of mind that the surgery is going to go well, peace of mind that what you plan is what you get, and it works from A to Z. I mean, and ultimately, that's what it's about.
Yeah, and the fact that the workflow is all within one company makes it just flow. When you've got one company that makes the cone beam scanner, another company that makes the software, another company that makes the surgical guide, another company that provides the implants, and you try to get all of them to work together cohesively, that's difficult. But when you've got one company all working together towards the same goal, it just makes everybody's life better. It makes less stress for the doctors, better results for the patients, and really has changed the game.
Well, you guys have been great. I do see a radio show in our future. J&T
I have
show.
a face for the T-bone. I have a face for radio.
Well, it is true. I'm not going to argue with you there. Thank you, guys.
All right, thank you.
Thank you, David.
All right, brother.
All right.
We'll take a short break and we'll be back with more Zero World 2016 right after this.